I am Dr. Amel Antony, Head of the Department of Radiology at Lisie Hospital, Ernakulam. I have been practicing as a radiologist for the last 22 years, and I am here to share with you insights on radiology as also the emerging trends and what radiology means in actual patient care.
Could you please explain us about radiology?
Radiology is the diagnostic division of medicine. In radiology, we rely on various imaging modalities to see the internal structure of human body, whether it is normal or abnormal. And the basic idea is to see the internal derangements of the patient without disturbing the patient in any way. We know that whenever we do surgery, we can see what is actually happening within the body. Now here, in a non-invasive manner, we are trying to look at the structures of the body, whether they are functioning normally or abnormally. And if they are abnormal, in what way are they abnormal? And this means basically a structural imaging where we look at the abnormality in the structures, and second, we also look at the function in a certain manner.
This year's theme is on emergency radiology, isn't it? Would you brief us on it?
Every year when International Day of Radiology is being celebrated, we have a special theme. Last year it was breast imaging, and this year the theme is emergency radiology. Now whenever we speak about emergency radiology, it's not just trauma care that should come to our mind. There are a lot of other situations where immediate care, immediate diagnosis is required. Now emergency radiology is all about radiology giving an immediate service with a lot of emphasis on precise diagnosis in a fast manner, so that a patient who comes in emergency need not be trauma alone. It could be a chest pain, it could be dyspnea, it could be acute pain abdomen, or it could be a patient coming in with hemiplegia or in a state of unconsciousness. Now the idea is radiologists work hand in hand with emergency medicine specialists or next to the emergency department, so that there is no delay in tackling a particular emergency situation.
Speaking about radiology, what importance does the day November 8th hold?
November 8th is now being celebrated as International Day of Radiology all over the world. Now we all know that it was on November 8th, 1895 that the famous German physicist Wilhelm Conrad Röntgen discovered X-rays. Now this was a landmark discovery as far as medicine was concerned. Even today, despite all sorts of discoveries and inventions in radiology, discovery of X-ray is considered as one of the most important 10 discoveries in medicine. We all know that this discovery of X-rays dramatically revolutionized diagnosis, because until that time we never had any modality to look into the internal structures of the body. With the advent of X-rays, we were in a position to see what the body holds and what the internal structures are and what the derangements could mean.
What are the different imaging modalities in radiology, and how can it be applied in healthcare? Radiology
comprises of X-rays or those imaging modalities that are using radiation, and along with that imaging modalities that do not have the risk of radiation. Now in the radiation group, we have X-rays of various types, which includes mammography, X-rays, CTs, nuclear medicine, and PET CT. And on the non-radiation side, we have ultrasound and MRI. Now though X-rays were used widely, you would have observed that the use of X-rays are now getting limited, mainly to chest X-rays and all in cases of trauma. So basically now X-rays are restricted to either orthopedics or chest, and rarely for head injuries, or it could be used in screening. Now in mammography, which is a modality based on X-rays, screening mammography is very important, so X-rays still holds good in mammography. Otherwise, X-ray is basically restricted to chest and orthopedics, and maybe as a pre-workup for giving anesthesia. Now coming to ultrasound. Ultrasound is the best modality for a screening imaging of abdomen, and it is a modality of choice for especially for gallbladder stones, for renal stones, and most of the other pathologies which involve the pelvis. Now remember, ultrasound has its limitations, but the advantage is it is widely available, it can be repeated, it can be a bedside investigation, and moreover it does not encompass radiation.